I was like, all right, I'm going to strengthen them in the way that they need to be strengthened. And every one of them became 100% pain free within like 6 weeks.
That's where the issues come to, part of it. We just, none of us have good
Yeah.
posture. You might start your day strong and say, today is going to be the day that I'm just going to stay.
One thing that you need control of is strength. And that's it. Everything else is out the window. It's like brushing your teeth or flossing, the dental recommendations and then the hygiene recommendations. You don't have to go to the dentist or the hygienist to get your oral exam. When I talk to people about this, you can tell the light bulb comes on and you can tell that it makes sense. And at the end of the day, they know strength is the answer.
Hello and welcome to Real Talk Beyond the Dental Chair. My name is Inma Steffe and I'm here with you again. I'm so excited about today's guest because he is tackling something every single dental professional can relate to, and that is pain. Whether it's neck tension, back stiffness, or sore shoulders, we have all felt the toll this profession can take on our bodies. But our guest had dedicated his entire career to helping dental professionals work and live pain-free. Dr. John Besharse is a doctor in physical therapy and a certified strength and conditioning specialist. He's better known as the dental physical therapist. He knows emotion physical therapy in the Emotion Performance Lab in Arkansas, created the neck and posture program for dental professionals, and is about to launch the Arm Operative System for dental professionals on September 1st. So guys, it's coming up. John, welcome to the show. I love for you to introduce yourself in your own words and tell our listeners a little bit about your journey.
So thanks for having me on, Inma. I appreciate it. This is definitely a great opportunity to be able to get some wonderful education out to the dental profession. My name's John Besharse. I'm a physical therapist, doctor of physical therapy, also certified strength and conditioning specialist. I've been doing this for about 12 years, 13 years now. I graduated from Arkansas State in 2014 or 2013. And then, I did inpatient rehab for a while and then transitioned and started my own private practice 2017. And it took me about 5 years. I was working full time at a hospital. And then over time, I was able to go out on my own. And so since 2017, I've had the business and now we're thriving and helping the community here in Jonesboro, Arkansas, and then surrounding communities. And we see physical therapy all the way from post-op patients, sports rehab to total knee replacement, things like that. Just making sure we get everybody pain-free and get them moving.
That's great. I mean, so necessary, right?
Yes, very much.
Yeah. So tell me, what inspired you to pursue a physical therapist to begin with?
Well, I kind of took the, non-traditional track. I got a degree in industrial technology in '02 and worked in another total different industry. I definitely didn't like that job. It wasn't for me. And so I went back at 28 and retook all my gen ed to get all A's so I could apply to PT school. And then basically I did college. I did college twice. But pursued that. And I just found out that I wanted to create relationships and help people. I just didn't know who I was when I first graduated. And then over time, through that job, I found out what I didn't want to do and then found out who I was. And then I wanted to cultivate relationships, help people and then I literally one day sat down with my mom in 2006, said, I don't know what to do. I Googled jobs that help people and a PT came up on YouTube helping somebody. I was like, that's what I wanted to do. And I haven't looked back since. Yeah.
Tell me, John, at what point did you realize dental professionals needed a specialized approach?
3 years ago, here in my new private practice, I saw several dentists, several hygienists, oral surgeons that all had neck pain, shoulder pain, back pain. They all didn't have the same, but it was one or the other, right? And so they came into the clinic. Again, this was all in a span of about 16 weeks. It wasn't anything that just was planned. It just, for some reason, I saw a bunch of hygienists and dentists at that time. And in the medical community, you'll have a stint of this kind of the same population for a little while, a certain group of people for whatever reason, it just by happenstance. So when they would come in, they would tell me, hey, I've got shoulder pain, neck pain. I've been to PT, chiro. I've been to massage therapist. I've done pain pills. I've done injections. And so when they came in, each one of them would tell their story. They would tell me everything that they had done at PT Cairo and everything else. I'm like, I got to be able to offer them something different because I'm wasting their time if I don't. So I better be on my game and offer them totally something different. The resounding similarities that everybody had was they didn't strengthen in their rehab appointments. They had all this manual therapy, they had stretching, and I was like, okay, the only thing left on the table is strength. It sounds like, why wouldn't people do that? Well, that's what people like, to feel good in the moment, right? Being rubbed on, stretched on, but it doesn't fix the problem. So what I did is, based on the positions that they're in, their daily activities, the muscles and biomechanics with regard to posture as a hygienist, dentist, assistant, etc. I was like, okay. And then obviously their diagnoses, I was like, all right, I'm going to strengthen them in the way that they need to be strengthened. And every one of them became 100% pain free within like 6 weeks. And they had done months and months of other things like decompression. Week after week, they'd go to the chiro, decompression with heat and massage twice a week for 5 months. Then they'll say, yeah, it helped, but it just masked the symptoms. And if they really want to be true to themselves and really tell the medical practitioner the truth, they would say, no, it really didn't. But that's another problem, is that patients feel I want them to have a voice and be empowered when they're here. And I want them to tell me the truth. Don't tell me you're better when you're not. But whenever they go somewhere else, they'll say, I mean, yeah, it's a little better. No, it's either gone or you're still having problems. I want your problem to be gone. That's it. And that's just the way I operate. I don't want you to, we're not going to just Band-Aid things. We're going to fix it. If you're 32 years old and you're a hygienist and there's not any specific damaging history or anything like that, your pain can be zero.
Yeah.
And that's what these people have to realize. They all did really well. And I was like, I've got something here. I need to be able to provide an outlet for this profession in a different way. And after a couple of years of thinking about it, create that program, the neck and posture program for dental professionals, kind of end of last year into the spring of this year. And we've launched it. We've done well. And then now the Arm Operative System for dental professionals comes out September 1st. And again, can't reiterate this enough. It's about strength. Most of all, you can't have strength without motor control and the signal to the muscle. People have got to stop stretching because that's creating muscle weakness.
Imagine that. I always thought that stretching would be a good thing to do, and it actually is not.
Not in this case, right? So what we're aiming to do is create increased capacity of muscle tissue and tendons with strength. And you can't do that with stretching. So when I ask somebody why they're stretching, when they have full range of motion, why do you stretch? They can't give me an answer because they don't know why.
Right.
What they've told, what they've heard. And then I'll say, why do you strengthen? They can give me an answer really quickly. So at the end of the day, we know that strengthening will increase tissue capacity, muscle, tendon, ligament, bone. If you strengthen your muscles, so does everything else, gets thicker and bigger. If it does.
It makes total sense. When you strengthen your muscles and you support everything surrounding
Right. You can't foam roll, you can't Theragun, and you can't stretch your way to bigger muscles. The only way you can have reduced pain in the operatory from a repetitive strain, tension, injury is by building resiliency and tissue capacity. And you have to have resistance strength program for that. And even going to the gym is good. However, I'm addressing more of what we call neuromuscular activation of the muscle, specifically based on the exercises that I've created. None of these are on YouTube. They're very thought out and specific and intentional to this profession. Again, I want to say I'm not anti-stretch. I am in this to treat something, and I am to fix your aches and pains, right? If somebody's casted and they broke their arm and they're at a 90 degree, right? Their bicep is going to be short and tight. So you're going to go do some range of motion and stretch that out. That's true stretching, right? That would be true shortness of a muscle. But what people don't understand is if you demand this much time in the operatory in this posture, which you can't get away from, I don't care what kind of ergonomics you have, your tissue capacity better be equal to that or this, a little bit above it. So your muscles should be able to stand the posture that you're in throughout the day. If they don't, this window is going to be where your repetitive strain injury ends up. I've created the program where you build resiliency and tissue capacity above your demand. And the program is that you do it in the operatory, 30 seconds, 45 seconds, 5 to 6 times a day. I've talked to several dentists, several hygienists, because if you have time to do this, then you've got time to go do what I've created. We've got to stop doing this because that creates muscle weakness, and we've got to start contracting. If I want bigger biceps, I'm not going to go to the gym and sit here and stretch like this.
Right.
So I'm going to go pump some iron so that I can go lift more weight, right? So if I'm having pain here in the hand or in the forearm and I see all these videos on TikTok saying go stretch, no, I'm going to go strengthen so I won't have. And so,
It makes
yeah,
and we all done it,
exactly.
right? Because I remember when I was like in the operatory, like my neck hurt and I would be trying to stretch my neck. And so we all have done
Yeah.
it.
It's just, and nobody ever fixes no, it. Everybody continues to do it, right? There's no like, I was able to stop last week stretching, or I was able to stop stretching. Stretching fixed me. I did it for 4 weeks and I don't have to stretch anymore. You stretch your whole life as a hygienist or dentist. You know what I'm saying? Like through the whole operatory, like it doesn't fix anything. People got to realize that tight muscles is only sensory. Because it feels tight doesn't mean you stretch it. Because it feels tight, it means it's telling you it's weak. That's the brain saying, I need more tissue capacity,
Yeah,
you
absolutely.
know?
Well, I'm so glad that you came up with this program because we can all use it. Tell me, John, can you share a memorable story of working with a dental professional who transformed their career by fixing any issues that they might have, any pain?
Just recently, I had somebody buy the program like 3 days or no, 3 weeks ago. And she posted on Facebook to this group. She was like, guys, I'm already finished with week 2 and this is so much better already. And so that was great. And then, the stories that it had already touched on, a couple of hygienists that had severe neck pain and shoulder
Yeah.
pain and strengthening them in the right way. They all leave reviews. I've got them on my In Motion Physical Therapy review page. I had someone dental clinic here in town bought the program and she'd had neck pain for, I don't know, constantly. She purchased the program. This has been several months back. And she was like, I saw her recently and she was like, after doing the program, she goes, I felt great. And now all I do is I'll do like 3 of the exercises that I really like and just maintain her
Yeah.
improvement. And that's what I like about the program. It's 6 weeks. It builds upon week to week and it progresses from more of a motor control muscle activation standpoint first, and then progresses into actual resistance strength. And it uses a little Pilates ball, a little small loop band, and then a little small resistance band. But you can get that on like my Amazon or on my Linktree. But I tell people, if you have something like that at home, use that. You don't have to go get this stuff, but you do need it by week 2. You need the equipment. But a little ball. I tell people even, I think it totals up. The ball's like $5 or $6, and the bands are not much. I don't know, $8.
Yeah. We all have stress balls in our
Everybody's got,
operatory. So,
so, but if you don't, the tools that I use in the program, you can get them. But obviously, I advocate for the best results to use those because that's what I used. And the program is me doing the exercises. You see me doing the videos. You see me
yeah.
introducing everything, how to do it. You can message me on the prep platform anytime you want. I will message you back within 24 hours personally. I don't have a large crew behind me doing things. It's all me.
Yeah. It's the life of a small business, right? But I watch your videos, and I have to say that every time that I had any question or have to reach out to you for any reason, you have been amazing, like very helpful. And not only that, but you answer right away.
Yes.
I'm sure that's because you're going to be busy, but it's very reasonable amount of time.
Yeah, I try to obviously go against the status quo. I want to be reached quickly, so I'm going to reach people quickly.
Yeah,
Questions.
yeah, I certainly understand that. So, what makes working with dentists and hygienists different from other clients?
Well, dentists and hygienists, assistants, the dental professionals, the posture that they're in, the beautiful thing about it is whether they realize it or not, their bodies aren't broken, their bodies are resilient, and they can overcome a lot of the aches and strains that they're having in the operatory. And so that's the part and they're a really great group of people, medical professionals, very receptive to and open and kind. And so that's really nice to have that audience as well. You know, again, it's barring, obviously some previous issue that they've had, they can make quite a bit improvement with strengthening in the right way. And that's what this, the neck and posture program is basically an injury prevention program. I do want to plug that it doesn't replace your standard PT or your physician or whatever you need to do for medical care, but
Right.
this is a injury prevention program, and so is the Arm Operatory System. And for them to be in these static postures, also the dental profession. Well, there's a lot of misinformation everywhere, but what I'm telling the dental profession is just basic physiology, and so there's not a gimmick, right?
Yeah.
It's just basic physiology. If you strengthen a muscle, it increases in its tissue capacity, which will increase in load. And that load is gravity, the weight of the head, arms, instruments, etc. And another thing is, too, the dental profession, they're taught ergonomics.
in school.
When I read these studies, the studies are based on, they talk about being in static postures. Well, what are
Yes.
we doing when we're giving ergonomics? We're promoting more static posture because with ergonomics, we're placing instruments close to us. I get the loops, but the loops promote a more static position, but we're reducing load on these tissues because of the position that we're in, which I would argue, do we need to actually strengthen the tissue instead of try to reduce the tension? Because we're
Yeah.
not building resiliency. As we age, we steady decline in tissue capacity. So if we're not doing anything to go the other direction and we're getting things to help us reduce tension, but also not create more tissue resiliency, that can end up being an issue. Strengthening plus ergo plus things like that would be great, but ergo will only take you so far until that one day your tissues won't sustain even the ergo position.
And you won't do it because I tell you what, we all have learned ergonomics in school. I was an instructor for 3 years. So I made sure that my students have good ergonomics and stuff like that. But you know what? When I worked in dental, the ergonomics out the window.
Yeah.
You had a difficult patient, like an elderly patient that cannot open their mouth well or it cannot lay all the way back. And there you are trying to see. And that's where the issues come to, part of it. We just, none of us have good
Yeah.
posture. You might start your day strong and say, today is going to be the day that I'm just going to stay. And you will not do it. And towards the end of the day, when you're tired, you're humped, you're like,
Yeah. Right.
it's horrible. We're terrible. We're terrible to our bodies.
Well,
That's why we have so many issues.
yeah, and that's the thing. Your posture is dependent on the patient that's in the chair. Right.
Yeah.
So that's not a good thing. The one thing that you need control of is strength, and that's it. Everything else is out the window, regardless of whether you think you have control of it or not. So I want to promote movement in the operatory. Let people know that yes, 45 seconds, 60 seconds of movement, 30 seconds of movement several times a day will be an absolute game changer for you. While the dentist is doing the exam, hygienist, go do the neck and posture program, pick out 2 exercises, do 5 reps, 5-second hold on the specific exercise that John created. It targets this instead of go stretch it, right?
Yeah.
Second, when you do the program, I make sure and say, don't stretch this out. When you feel this fullness from resistance and activity of the activation of the muscle, that's blood flow. Don't go stretch stuff out after you've already activated the muscle because we know passive stretching creates muscle inhibition. Muscle inhibition, there's a little muscle spindle in the muscle. If you pull on it for too long, the brain sends a signal and creates inhibition, and it reduces force output and muscle activity. It's short-lived, but if you do that every day, you're in constant inhibition. We need it to be in activation. So people have got to understand that it's not just muscle, it's a signal from here to the muscle that's got to be sufficient. The muscle's performance is only dependent on the neurological signal from here to the muscle. It can be dampened a little bit based on pain and stiffness, stress, sleep, lack of sleep. You get what I'm saying? So that's all these neck muscles, shoulder, all the way down to hands, core muscles, everything becomes slight, it's almost like turning a dimmer switch down. Imagine doing a procedure with your instruments without the lamp. It would be extremely hard to do. That's what the muscles are screaming to you when they're saying, when they feel tight, when you feel them being tight, they're saying, turn up the dimmer switch, the signal to my muscles so I can contract fully to help you in this position.
Even with the lamp, it's difficult because I don't use the lamp anymore. I have a light on my loops, and I think that most of us do. And if they don't, they should, because you don't realize how little you saw with that, even with that powerful lamp, until you get a light on your look. It's more lighted, you can see better
Yes.
night and day. And also your ergonomics suffer too when you have a light that you have to always reach out and kind of adjust here and there. So
Well, yeah, and talking about posture, I want people to understand that your body's 3-dimensional, not 2, right?
exactly.
And we've got to stop putting limitations on our body because it won't have limitations as long as it's strong enough. If you're strong enough, you should get through the day without discomfort.
So I already know the answer to this question, but I'm going to go ahead and ask it anyway because somebody might not know. But how common are injuries, musculoskeletal disorders in dentistry?
Yes.
And what are the most common pain hotspots?
So I know for hygienists are most susceptible, first of all. Third of all, hygienists have some type of musculoskeletal repetitive strain injury. It's anywhere from, as far as just aches and pains, I've read several studies where it's anywhere from 50 to 75% of hygienists have some form of discomfort throughout the day, whether it be headaches, neck pain, shoulder pain, elbow, wrist, hand. And then as far
Yeah.
as injuries, we're looking at carpal tunnel to be extremely, I think it's probably the top medical diagnosed issues for hygienists. Dentists tend to have a lot of neck pain and shoulder pain and low back pain. And so, it encompasses basically all the way from the foot up to the head, depending on the position that you're in and what your role is in the operatory. But I would say carpal tunnel from a diagnosis standpoint, golfers or tennis elbow, it's called
Yeah. Sure.
frozen shoulder, lateral epicondylalgia, or tendinosis. But again, a lot of it is these tendon, the musculotendinous junction where the tendon and the muscle comes together, or the tendon or the tendinous junction where the tendon inserts the bone, and that's where most of the stress comes from. And so, your tendons and your muscles, they're two different types of tissue, and so one's going to be more ability to handle more load than the other. But overall, that's where most of the issues sets up. So, frozen shoulder tends to be a lot more systemic in nature, kind of an inflammatory response, that we're seeing in frozen shoulder, not necessarily just a tissue only. But carpal tunnel, lateral epicondylalgia, tendinosis, cervical headaches,
Yeah.
base of the skull, tightness in the neck, just cervicalgia, what we call cervicalgia, just pain in the neck. And then we do see we do some see some degenerative disc disease, degenerative joint disease, but we also know that over time that's also age related as well.
Yeah.
Some would say we could kind of avoid that with strength. Some would say that we can't avoid it anyway. So, but disc bulges, pain down radiculopathy, cervical radiculopathy down the arm. So I've seen.
Why do you think that these issues get overlooked in dental education? We certainly learned about posture. Why doesn't anybody teach us how to control our muscles? I mean, perhaps we should you should go to dental school
Yeah.
and
Well, my
and teach them.
Yeah, I look forward to being able to teach some CEs and also be at dental colleges of dentistry and colleges of hygiene and things like that as well. But I think again, it's just like anything else that things were adopted from years past, and while it's not bad, it's probably not the best, and most effective. If it was effective, it wouldn't be an issue. So I feel like it's just I'm able to look at things and through a little bit different lens. Dentistry is dentistry, right? That's ergonomics, biomechanics, and kinesiology is just a little small portion from it when it comes to actual care of the hygienist or the dentist or the assistant or the dental professional. Just like any other
Yeah.
profession, things get in the way, and so you pick the what's been touted as the thing to do, but always they teach stretches, and they teach ergonomics and they teach posture, but we need to teach physiology along with that, which extremely delves into a whole nother semester, right? And so it would be a lot of coursework. And so you can have somebody like myself who can, bring it all together and within a short amount of time, hopefully provide a great message and another way of looking at things to provide longevity in this field.
Yeah, for sure. I think that that your program should be incorporating all dental hygiene and dental schools.
I've provided programs and an avenue for people to do that easily versus trying to figure, well, what do I do? Or I already go to the gym and strengthen. This is different. It's a little bit more.
It's target.
Yeah, it's specific to, right. You can go to the gym, but it doesn't mean that you're going to target what you need to target while you're in the operatory. So that's
Yeah,
the
you're
big takeaway, at the end of the day is just strengthen. Tissue capacity has to be greater than demand.
So, what is the long term impact if professionals ignore these issues?
Yeah, I mean, early retirement, obviously poor morale, more cost issues, sick leave for dentistry, clinic owners.
Yeah.
If you have a staff that obviously is in discomfort or pain or tight muscles all the time, it definitely reduces that ability to create and build rapport with the patient.
For sure.
For hygienists, dentists, or assistants and oral surgeon, periodontists, orthodontists to have discomfort while they're caring for their patient. I want them to not have to worry about this discomfort in their shoulder or their hand or this tingling when they're still working on someone and worried about, is this going to turn into something bad? If I ignore this for the next 6 months, is this going to be like where I'm dropping my instruments, or do I need to go get this checked out? While they're performing their procedure, I want them to be, free of that, right? In some regard. That's what's important, is to be able to enjoy your job without having that dark cloud over your head and you're trying to play, like everything's okay while you're filling a cat,
Yeah.
doing cleaning teeth, or, I want that to be just that component of the dental profession. I would love for that to be reduced or dumped by you professionals, and not mentally, it's mentally exhausting. And then at the end of the day, when you go home,
You're not in the
yeah,
mood to
you
deal with
just, well,
anything.
you're tired. Your tissues are already worn out. It's painful. And then, you wonder, will I be able to do this for another 20 years? And then the weekends. And that's the part where people have to understand that muscle activation and strength doesn't take an hour in the gym. It takes a few bites, a little bit at a time. It's like brushing your teeth or flossing, the dental recommendations and then the hygiene recommendations. You don't have to go to the dentist or the hygienist to get your oral exam every day.
Yeah.
Maintain by cleaning your teeth and doing a little bit every day, cleaning your teeth, flossing your gums, to have good oral hygiene. And then you go check up with the dentist, get that biannual or quarterly cleaning. And same thing with this, is you do a little bit every day, 45 seconds, like the time it takes you to brush your teeth, less than that. What is the time on it? I don't know.
2 minutes. 30 seconds for quadrant.
Okay. All right. Great. Yeah. So you can apply that to this. Like, you don't have to have a 25-pound weight to gain strength. You don't have to have a loaded barbell. You just need resistance, or you need muscle contraction for the signal. You don't go stretch it. You feel something tight, activate it. Don't stretch it. So I've created the programs and these programs upcoming that will facilitate, activate these muscles instead of pull on something that's already mad. I was watching TikTok the other day, and unfortunately, a hygienist who also is a movement coach were telling people they put their thumb in their hand and stretch like this. Well, right here, you've got extensor pollicis brevis and abductor pollicis longus, and this is anatomical snuff box. And de Quervain's tenosynovitis is very common as a dental professional. And then if you have that, or somebody feels discomfort there, and then you go pull on tendons that are already inflamed, right? That's a provocative test that we learn as a physical therapist and doctors learn to rule in an issue. I'm not going to use a provocatory test as a means of treatment, right? Because it's provocative. We're provoking symptoms.
Right.
We're provoking symptoms. And I see it all the time. They don't know it's a provocative test, but because it hurts so good, they'll use it as a stretch. And that's why people's problems steady just get worse and worse, or they stay the same.
Yeah, it's unfortunate. Sometimes we do get the wrong message. But doctor, if someone is listening and is already in pain, what is the first practical step that they should take today?
Well, I will say, if you're in, true pain, if you've been dealing with something for a long time, go seek out a physical therapist or your PCP. Definitely want to say that first, because that's most important. Get things ruled out that there's not anything going on that's serious. And then after that, I would look at, strengthening. Obviously, I'd encourage you to look at my website, in motion physical therapy 870.com. And then and also the dental physical therapist on TikTok and Facebook and Instagram. And, there's some tips out there that I leave and things that we've talked about today, but I just encourage everybody to have a little bit more of an open mind and know that everything in the past up to this point works a little bit. I want it to work a lot, right? I want to give somebody, let's take what we know and not disregard it, but let's venture out and look at strength, right? No gimmicks about that, just strength. And let's replace a little bit of this pulling and stretching on stuff, instead of doing this in the operatory after you've been in this position, instead of just going and doing this, pulling on the things, let's look at a little bit at some activation versus passive stretching. And also with all this, I want to reiterate, not against yoga, Pilates. Your muscles are active all the time, right? I'm not against any of that. I'm just against using something passive like that or something externally to treat a problem, because we know at this point it hasn't worked.
And you mentioned it, the Polaris and yoga. Yes, a lot of us
Yeah.
tend to do Polaris and yoga because we think that, and this is not just exclusive to dental professionals. I see a lot of healthcare professionals that do the same thing. I have friends that they're doctors, nurse practitioners, and they'll tell me I go to yoga or Polaris. It's an epidemic.
Well, they can go to yoga and Pilates, but again, it's not specific enough to the posture that they're in the
Yeah.
operatory. So that's why I created the programs, is that they're specific to the posture that they're in the operatory. I want you to be in the postures you have to be in the operatory. I don't want you to avoid those postures because your body's three-dimensional, resilient, and amazing, and it doesn't have to be modified all the time as long as you
Yeah.
strengthen it.
So, how much time does it realistically take to build healthy habits in a dental schedule? Because that's kind of
I mean, honestly, I've got around four to five exercises or 3 to 5 exercises per day. Okay.
okay.
But they're, again, it takes you to do 3 exercises. It takes you like a minute. So I would tell people, run through the 3 to 5 exercises. It will take you about 3 minutes before your first patient. And then if you have time in the operatory before the next one comes back, or the dentist is doing the exam, you can do it in the operatory. You don't have to, like, I've got, the walls are creating the resistance. Your body weight is creating a resistance. So you really have no excuse. Obviously you want to be professional. If you want to go around the other operatory wall or go, into the lunch room, whatever, you can just hit a few reps of something and then come back in like it. And then, hour and a half later, or when you have that opportune time, hit 2 or 3 exercises. It will take you like a minute and a half max. And then at lunch, run through 3 or 5 exercises. It'll take you about 3 minutes. Same thing in the afternoon. So they're little bites of stuff. And it's not like having you do 3 sets of 10. It's none of that.
I think it takes like 20 days to develop a new habit.
Yeah.
So and we have to do it. We have to be consistent.
Yeah. But, the program that I had, it's 6 weeks. It builds each week, week to week. And I can tell if you do the program or not. You have to check off. Some people do it without checking off, but I would rather you push the button saying you completed it, because I want to see, you know,
Right.
I'm invested in strength. There's nothing wrong with getting stronger.
What is the response of the dental professional?
It's amazing. It really is. And then the fact that, I've done some lives on TikTok, and when I talk to people about this, you can tell the light bulb comes on and you can tell that it makes sense. And at the end of the day, they know strength is the answer. I'm just trying to provide an avenue where it's not so daunting to do. So,
Right.
it's been comments. I need you in my life. Where are you? Why are you in Arkansas? You need to be in New York. Where was this 20 years ago?
Yeah.
This is crazy, mind blown. It's always that response. It's never been a negative response, because I think at the end of the day, it's basic fizz. People know what it does. And so, again, I just provide the avenue for them to do it.
Yeah, they feel it. So, how do you stay healthy and balanced while running multiple ventures?
So I get up about 5:20. I go work out, and then I work 8 o'clock. I'm in bed.
Oh, 8 o'clock.
Yeah, I get in bed.
Well, you get at five.
I
Right.
get great sleep. Sleep from 9 to 5:15. It's a lot. It's good.
Yeah. I wish I did that. I'm
I'm not.
terrible.
Definitely want to give the audience this perception that I'm perfect, because I'm definitely not. I love my chips,
Oh, that's good.
whatever that might be. If it's a bag of chips,
They taste so
I
good.
can't put it down, So, yeah, chips are my weakness. Cheese balls are amazing. Oh, I wish I could eat those again. I'm not too old to eat that in one sitting, but I try to watch what I eat. I just give myself a continued mental, like, what are you doing? Why are you have this in your hand right now? I'm constantly just, because if I take, if you give me an inch in the kitchen, I'll take a mile. So my wife has to hide some of her stuff. She's very disciplined, and she can take a cookie and make it last for 2 days. One cookie, she'll take a little piece,
That's amazing.
and she never fails. So I'll take 5 cookies and make them last 5 seconds. I'll just tell her to put it all up at the, like, she hides it from me. So yeah. Anyway, I'd try. I'd try.
I tell you what, I'm not a sweet person. I don't like sweets too
Me
much.
neither.
So I can take cookie last. Now, if you give me a bag of chips,
Yeah,
that's the reason why I never have them at home. You will not find them in my
I
house
know.
because if I eat the first one,
Yeah,
I just messed up.
I'll sit on the
Yeah,
couch and I'll
they'll be gone, and then you feel guilty
oh,
about it, right?
terrible.
Because it's like, "Should not have
Yeah.
done that."
One night I did that recently, like 2 weeks ago, and it was like 9 PM, and I told my wife, I was like, "I gotta go ruck real quick." So I went and rucked for like 2.5 miles with 30-pound weight on my, vest on, and I was like, "There's no way. I gotta go do it." And so by about 9:45, I was, took a shower, went to bed, but I felt better afterwards. I'm glad I went and did it. But yes, terrible feeling. It's a great feeling like you're eating a
Yeah.
bag of chips.
So what is one of the wellness practices you will never, ever skip in your life? Do you mind me?
A wellness practice would be resistance training. So I think the message you'll see, you may have seen this. Some of the audience may have seen this, but we're starting to see an increase in trying to increase muscle mass in everyone. Right, our lean body mass has to increase for longevity because we know muscle's not inflammatory; it's the opposite. And so we want as much muscle on us as we can. And I tell people and ladies and men, don't worry about looking all bulky. What you need to do is try to get as bulky as you can because eventually that's going to start to go away anyway, whether you want it to or not. So you need to stay ahead of the game.
Yeah. Awesome. So what advice would you give to dental students and new professionals to protect their health from day one?
If you have time, this is the most important part: is educate yourself. Right, find out who I
Yeah.
right? Learn about me, research it, think about it. Like that would be number one. Find out who you get advice from. And then two, know that the basics, dental professionals, sleep, hydration, nutrition, stress, strength are the foundation to longevity in the profession. Of course, that goes along with life in general. So, yeah, I think that would be number one. And then if you have any questions with any of that, obviously you're welcome to message me or anything like that if you need any help with figuring out any of that stuff.
Yeah. And John, this has been such an eye opening conversation. Thank you for sharing your knowledge and passion for helping dental professionals to protect their health and enjoy longer free pain
Sure.
careers. So, before we wrap it up, can you tell our listeners where they can contact you, learn about your
Yes.
programs, and maybe even work with you directly?
You can contact me at john at thedentalphysicaltherapist.com. So you can message me on Instagram, Facebook, or TikTok on the dental physical therapist.
And guys, I will go ahead and leave all the links below. So if you would like to contact John, please feel free to do so. Just push the link. And thank you again, John, for joining us today. And thank you to everyone listening to Real Talk Beyond the Dental Chair. Don't forget to check out John's programs. We'll drop the links in the show below. And until the next time, stay healthy, stay inspired, and keep smiling and flossing. Bye, John. Thank
You.
you.